Hi friends, if you are considering hair transplant as an option and if you are doing your research on this very topic, you must be knowing this fact that results of hair transplant are not permanent. Do you know this? I hope most of you know this, but if you don't know this, please watch the video till end. I'm your friend Dr. Shail Gupta and I'm a hair transplant surgeon who has been doing hair transplant surgeries for almost 20 years now. I have been doing surgeries for that long period, and it was like 4 years back when I shared this information on public platforms, public forums that results of transplant are not permanent. These hair can thin out, and I was observing this for you can say around 5-6 years, but only 4 years back I gathered enough courage to tell these things on public platforms. When I introduced this concept 4 years back, I was opposed a lot, even from some of the colleagues, and a lot of people said that results are permanent because the hair are DHT receptor resistant. They don't have DHT receptors, so they don't fall, and this is kind of permanent thing, and all this is bluff. You know what? Even I faced resistance from inside myself. My staff also told me that if you tell this, then who will come for hair transplant? And the purpose of making this video was not to discourage you, but to give you information, correct information, which is a must, which you should know. At that time, I was confronted. A lot of people, doctors said that no results are permanent and all that stuff. But now, most of those people are also uh, kind of accepting this fact. They have noticed this because a lot of people, you common people who got the transplants done, they know, they are sharing it on public platforms that yes, there is thinning, these hair thin out, fade out. We have seen a lot of celebrities also. One of my favorite tennis players, Rafa Nadal, he got a transplant done few years back, but now he's again thinning out in the same area. So we see a lot of cricketers, actors who got transplants done and they are thinning out. So the concept of hair transplant was phenomena of mother dominance. That means we take out hair from back of your head. These hair are DHT receptor resistant. They don't have DHT receptors in it. So when we plant that, they keep on behaving in the same way as the mother side. So they keep on growing. So this is true. But there is another thing which is called phenomena of recipient dominance. See, I did my eyebrow hair transplant few years back, and the hair which I planted, I had to cut them earlier, like every week or every 10 days, because they were growing at a faster pace, because they were taken from back of my head and they were scalp hair, so they were behaving like the scalp hair. But now over a period of time, these hair have thinned out, the thickness has reduced, and they don't grow at that pace. So I cut them every month, maybe 2-3 months sometimes, So this is important. You must know this. Do you know that a lot of people who get a transplant done, they need another transplant sometimes in less than a year's time? 2 years, very common. One reason could be yes, they have a bad transplant. They are not happy with the density. They are not happy with the design of their hairline. Almost 70% of patients who come to me, they come for repair hair transplants for this thing only. Now what happens if you get this thing done, that's okay. Another reason for this is the non-transplanted hair. See, first of all, there is nothing permanent in this world, and change is the only constant. I always tell this, and I think this is a good thing to understand spiritually also. But now, there are two types of hair when we do a transplant. Uh, in fact, I would say there are three types of hair. Okay, let me explain you this with the help of an example. What are these three types of hair? This is interesting and you must know this. So now, this is one of my friends. He is a doctor. We did his surgery only in the frontal area over here. We did the surgery. We did the 2000 FUE grafts for him. You can see only this part, and the crown portion was totally untouched. We did not do anything at all, and his crown was like this, as you can see. So the transplant was done only till this portion. Now we see this entire thing like kind of filled up. So there are transplanted hair in this portion. There is existing hair in this portion, which are like still there, and there are new hair which have grown because of the medicine. Finasteride I gave. So see, there are a lot of doctors, clinics, which give finasteride to all of their patients, irrespective of their age, pattern of hair loss, previous response to medicine. Uh, Probably they don't want to keep this drug as a reserve drug and use it in only those patients who actually need it. And we also have to see the phenomena of tolerance which can happen to medicines. So a lot of people don't talk about this, but if you are really serious about hair transplant, you must know. You must know this. This hair growth which has happened in the crown area over this portion over here is totally because of the medicine and PRP which I did. So these hair are, we gave him finasteride on alternate days, and these hair are going to stay here as long as the medicine is working, as long as he is taking finasteride. If he stops taking finasteride, these hair are not going to stay there. And you know, if the medicine stops working on his head because of tolerance issue, even if he is taking the medicine, these hair will again fall. You understand this? This is very important. Another problem which we see with this is, so if you see, this patient came to me after getting 2 transplants somewhere else, and now if you see, this portion is thinning. Now this portion is going, and this is the transplanted area here, and here also you can see the guy is thinning over here. His age was 21, and at the age of 21 when he came to me, he had already got 2 transplants done, and this was from the top view. So if you take a careful look at this portion over here, these hair are like quite thick, and he must be having a good donor to have this kind of hair in the crown area. But now take a look at his donor. Unfortunately, his donor is exhausted because of 2 previous surgeries, and grafts have been taken from the unsafe donor zone also. I hope you know the differences between safe and unsafe donor zone. If you don't, watch the videos. There are plenty of videos. I think you should go and watch every single video which is present on Satya Hair Clinic channel on YouTube. Go and watch it. It's a humble request. Please, please, please. And share these videos with your friends, because this information you are not going to get anywhere else, because nobody is going to talk about this. Okay? What will we do from this donor? Very small options. I'll make a separate video and show you guys what I did in this case. Another problem can be thinning of the transplanted hair also. This was the thinning of existing hair. The transplanted hair can also thin out. So let me show you this. Now this is a patient which I operated around 10 years back. We did FUE at that time, and this was his condition over here. You can see. So this was his condition. Okay. So we did the transplant, and this is, I think, 2 years after the transplant. So this was looking much better and quite nice. But these transplanted hair, and this transplant was done in the where he didn't have many hair, I mean just small hair in that on that side. We did the surgery, and after few years, around 10 years, you can see the transplanted hair have thinned out. You can see clearly transplanted hair have thinned out. So this is because of phenomena of recipient dominance. So these hair can thin out like this, you know. If you don't pay attention to this, then you are going to be in trouble. You understand this? Compare this with this. So these hair actually got thinned out over a period of time. We can see these hair thinning out over here. So now this problem can happen, and this is a very common problem, and one must use medicines in order to prevent thinning. Now, at when these medicines should be used, how many medicines do we need to bombard the patient, every patient, irrespective of their age, previous response to medicine, availability of donor, uh, rate of thinning. There are so many things, but irrespective of that, every single patient, if I bombard the patient with finasteride and minoxidil and supplements and everything, now this patient can get tolerance, can develop tolerance to these medicines in some time, and then everything will be kind of a waste. So we can slowly introduce the medicines, we can keep some medicines as a reserve drug, but in that case, the doctor won't get that photo opportunity. So if I prescribe finasteride to all my patients after transplant, then obviously the results which I am getting without finasteride would look like double or triple because of thickness of the miniaturized hair. These are very important points. If you don't understand this, are you with me? Are you getting it? If you are not getting it, we shall, explore these things. I'm your friend in this journey. I'm not pushing anything on you. Okay? So try to understand this. This is very important. If you don't understand, ask questions in comment section. I'll answer them. Call us at the given number. You can drop messages. Sometimes we are not able to pick up the calls because a lot of people are asking questions, calling. So drop the message. We'll get back to you. Have some patience, but these points are important and you must understand. So I hope now you are little more enlightened on this topic, and we will together we shall continue this journey. There are so many, almost 350 videos on my YouTube channel, Satya Hair Clinic. All you have to type, and it is my humble request, go and watch all these videos, and we'll keep making such informative videos which are actually going to impact your final outcome. And how long does it persist, the longevity of your result, because you have to use your resources carefully and thoughtfully. So if you have questions, write to us, ask in comment sections, and you can also fill the contact form given in description. Thank you, love yourself and stay blessed.